Good afternoon, everyone.
Hi.
So we're going to be chatting a little bit about AI and what's happening firsthand with two of our best community leaders here representing FIU and Jackson Health. So I'll just let them intro themselves real quick, and then we're going to jump into the conversation.
Hi, everyone. Good afternoon. How was the break? Did everybody get a lot of sugar and coffee? Hopefully. That's wonderful. It's awesome to be here at FIU. FIU is my alma mater as well. And so my name is Connie Barrera. I am the CISO at Jackson Health System. I've been at Jackson Health for the past 12 years, building the team from the ground up. It's been such an amazing and challenging endeavor. I have some of my team members here, so I really appreciate them attending as well. We are the third largest health system in the country from a bed count perspective. Jackson performs every type of organ transplant known. We have clinics around the community. And for those of you that probably see University of Miami, it's usually University of Miami and Jackson Health System because we're highly intertwined. And not at FIU. I wouldn't say this about FIU, but University of Miami is the Wild West. And so it presents some unique opportunities and challenges for Jackson in that incredible partnership that has always existed. So in any case, I look forward to the conversation. I've known Helvi from when I was a student, and I'm so glad to be up here with her. It's my privilege, and I'll turn it over to you.
Likewise, happy to have you back at FIU, and I'm looking forward to our conversation today. Helvetiella Longoria, Chief Information Security Officer here at FIU. I think we have a similar dynamics in that we have some similar challenges regarding our technologies, our users, governance and compliance that we have to adhere to. So I oversee all the security here at the institution. We also have multiple campuses combined with research and the education piece, as well as our business units, which is like a mini city police department and retail space and what have you. Looking forward to our conversation, and welcome to everybody. Thank you for coming to FIU.
Thank you both. So by now, in general, we'll know AI has brought opportunities and risks. And it's brought with different magnitudes and different industries and different responsibilities. So with that in mind, and given the brief context that they have provided about the organizations that they're leading, let me start with some of these topics. So can you guys talk to me or talk to us about the biggest challenges that you have come to encounter? And this is practical, you hands-on, leading the organization, seeing AI unfolding on all of us and all aspects of life. In this role within your organization, what are the biggest challenges that AI has presented so far? One take.
So far, heartburn. No, no. Here's the thing. Healthcare up until now had been a target of opportunity, but healthcare has become a target by design because nation states, ransomware groups, and just the common criminal all know that we have one of the most complete data sets. And they also know that we have legacy systems and low budgets and things like that. So AI has really allowed adversaries to craft really sophisticated and contextual attacks that are not educating our users, is not anymore telling them this email has poor grammar, this email has spelling mistakes. No, these emails, and it's not just emails, right? It's voice and video. All of that put together is what's making attacks much more difficult for the average user to determine. And so in that sense, when it's not only the scale, the speed, the iteration, it's not one email that's sent to 10,000 people and it's the same exact email. It's an email that is constantly shifting. The sender is constantly shifting the subject, it's constantly shifting the messaging. And so in that sense, it's made security awareness more difficult. Because I'll tell you this, and my team and I understand, it's a little irritating. For the past several years, we have a red team exercise contracted by internal audit. And that red team does not get in through technology. No, that red team gets in through phone calls. and having somebody be all too willing to participate with, hey, go to this website, hey, click on this, click on that, and then they're in. But so from a technology perspective, I think one of the biggest hardships right now, at least in healthcare, is the social engineering. It's skyrocketed the sophistication of with AI.
Yeah.
Sophisticated attacks. What about?
And I think we see that here as well. We're seeing that all over the industry. If you look at some of the recent breaches, it has been through social engineering help desk. And it goes back to educating our frontline staff on what they need to look for, making sure they can identify potential deepfakes, potential social engineering type attacks, making sure that if they don't feel comfortable making that decision, to pass it to a next level, because it's a lot of responsibility that we put on that frontline support. They're there to help and they want to help the customer. We encourage customer service, but at the end of the day, we're also putting them in a position where they have to make a decision to decide, is it a legitimate user or is it not? So I think education at our first level support is important, but also at the rate that AI has allowed for vulnerabilities to be disclosed and exploits to come about, it makes it very challenging for our teams to keep up, right? Just like in healthcare, we're highly targeted and we constantly, phishing has been an issue, ransomware attacks. And if you look, higher education and healthcare are always on the top when you're looking at attack because of the data that we hold. And in higher education, you have many regulations we have to follow. We have HIPAA because we have a College of Medicine and we have a medical practice. But then you also have the federal education and you have PCI. So we always have to be at the upfront to understand where is that data and making sure that we can identify and be able to look at the systems that have that data so we can protect it.
And how many of you heard of the no treasure hunt that Anthropic came up with, all the massive number of vulnerabilities, right, with Mythos? And that's insane. And I think that's really because of AI, the AI capability that's really untapped, it really being tapped by the adversaries and not perhaps used yet, even beginning to be used to its potential on the white hat side.
So, and I'm very well aware of this pain that we endure, and we've been talking about these things for years. We had this challenge, right? The traditional issues that we couldn't cope with, and now it's like getting accelerated by AI and so forth. But on the other hand, AI is also a tool that we could employ to solve problems. And among the many challenges that come in that are putting a strain on the teams right now, there has to be something good that we may be doing with AI today that we could maybe pivot a little bit onto. So the next question is about specifically, since you alluded to incidents and attacks and all this going on, is there anything that you could tell about how AI may be helping in dealing with this force that is coming at you at such velocity? So Kelly, you want to take that first?
Sure. So we can also use it for good in our SOCs, right? Look, leveraging AI in our SOCs to be able to respond and do some automation and detection based on what we're seeing. The amount of data that we consume and that we see from all our systems, all the way from the network, all the way to our applications, is unmeasurable, and we don't have enough resources or manpower to go through that. So leveraging tools like AI to help us weed out the noise, but also to respond on things that you know are very common, that you have a certain action that you can perform. Leveraging AI in order for us to be able to respond to some of these things is going to be critical in all of our teams, because that's the only way we're going to keep up. We're already behind the ball. And if we can't start implementing AI to help us do some of this detection and mitigation, that we're never going to be able to keep up. So we're always going to be a step behind.
True.
Yeah, absolutely. So in the hospital, we're using AI a few ways. And I'll say this, I think it's important to understand that when people say AI, that means a lot of different things. And at the same time, in my mind, it's been overly used excessively from something that's really like automation and like scripting with a little bit of intelligence, calling that AI, where it would have before been some kind of orchestration, but not natively an AI, if it has all of the components, all of the layers and things like that. But that being said, in the hospital, we're using it for processes where the human was prone to having a lot of errors. For example, a patient might need to reschedule their appointment, and that appointment has some dependencies. Those dependencies might include having an X-ray, having blood work, etc. And if that appointment was not transferred appropriately, those physician orders would just vanish. So if you can imagine having to call a physician and asking them to put in those orders again is highly problematic. And so that's one way where this AI process that we're using to reschedule appointments in mere seconds can handle dozens and dozens without any error, without dropping any dependencies. Another thing that the radiology, the doctors that handle all the imaging, right? One of the key things in a hospital is blood work. And another thing is having images from your body, whether that be x-rays, MRI, CT scans, etc. So having AI assisted reading of those images is being much more embraced throughout different hospitals. It doesn't mean that it's going to replace physicians, but it does mean that it's going to be able to provide those results sooner. And lastly, the last thing I'll share for now is that for over 10 years, we've had one of our most important solutions that we use to give us east-west visibility. As we know, one of the most critical things from an IT SOC perspective or IT defenses is that when something is allowed to come into your network through the firewall, most organizations have been blind. And we can say that with confidence because statistics show this, that organizations have been breached for 9 months. They've been breached for 18 months and they didn't know it. And so a solution we have is really AI. From over 10 years ago, it was the brain, the central appliance. It has sensors throughout. And it's really what's made a huge difference for us in day-to-day. We're also putting in with some new firewall acquisition. We're making huge strides into putting in microsegmentation with an Internet of Things module that I'm sure we'll talk a little bit more about a little bit later. But that's some of the ways we're using it for security operations, AI. We're using it for appointments, and then we're also using it for care. So AI really is making its way throughout the different line of businesses at the hospital.
Yeah, and I think to add to that is as we go through these paths, right? Because we have something similar for student success, right? How we're using AI for that. But from a security perspective is how are we securing that information? Are we letting it leave our premises from in our case, our student management system, or is it going to stay within our student management system? And the question then bears is in-house or out, right? Are you going to develop an AI cluster to be able to manage and keep that information in, or are you going to rely on third parties? Because then you have to think about third-party risk and what does that risk entail, right? So as we have different areas of the institution, creating AI agents for operationalizing some of their tasks, similar like your team has done, from a security perspective, is we have to be at the table to understand where is the data moving, because the data proliferation is a big security concern and a big security risk. When we're talking about student data, you're talking about primarily FERPA data, and there's certain requirements that we have to make sure that we can comply with. So the conversation around, we want to keep the data as close as possible to us. We want to know where the data traverses, and following our data classification policy very closely is going to be key. And the only way we can make sure that our organization understands that is by educating on our AI governance and our acceptable use policy, so that they know the same data classification you've been using for the last 10 years will apply when it comes to AI. You have to build those guardrails to make sure that they understand what is their limitation. There's some things that they can do without any, if it's public data, but if it's regular data, they have to follow certain requirements. So making sure that your users understand if you have a governance policy or an acceptable use policy, what are those guardrails, and be at the table from the very beginning, right? You can't come to the table when they already created this AI agent and it's already,
Up and running.
it's up and running, and they think it's the greatest thing because they were able to save time, but you're like, oh yeah, but stop. Now you can't use it because, and you want to enable them to use it, obviously. So you want to be at the table very early on.
All right. So I hear there are some good things that we've been able to do with this and some good practices that we could wrap around to use it and maximize. But the environments that you guys are managing, they're not fresh and they're not new. There is older technology that coexists in these environments. So let's talk a little bit about the challenge of managing legacy systems in your environments as it pertains to the adoption of the newer technology to solve today's challenge. So you want to take that?
Sure. So absolutely, if there's a sector that has legacy equipment, and this isn't necessarily about Jackson, this is hospitals everywhere, whether hospitals in major cities or hospitals in rural areas, all hospitals have legacy systems that pose great challenges. Just to put it in context, we have hundreds of servers. We have about 14,000 endpoints. And I say an endpoint, a traditional computer, but we have over 25,000 pieces of biomedical equipment, and these are all networked. Each of these has a different vendor risk profile. Each of these has a different patching cadence. All of them are certified by FDA, Food and Drug Administration, Part 11 compliance, which means you cannot drop any agents, you cannot update them yourself. So basically, they're sitting on your network, and it becomes a huge risk profile. I remember back 2017 Mother's Day weekend when WannaCry hit the planet, right? And I think in the United States, we're very lucky because it hit Europe first, and it really crippled the European health system. And so I know malware researchers everywhere found a kill chain. We put in those configurations, and then we were fine. But still, a lot of biomed equipment had to be reimaged because even though it didn't become encrypted, it did become infected around hospitals everywhere. One thing we're doing that goes back to our major firewall project that we started last summer is with the IoT module. That IoT module will allow us to set policy on, for example, if you have infusion pumps, and if you have GE versus Bebron, and one of them becomes infected, you can kick the infected devices off the network. If even in a building, even on a VLAN, so it's very granular. And that's really where we want to be, more of a zero trust framework. The thing I would say, though, is that we do want to be very careful because AI has blown the lid off of any concept of zero trust. You really have to realize that when you're using AI, the guardrails are totally gone. Did you guys hear about the McDonald's or Chipotle AI little incidents? Okay, so those are very interesting. The YouTubers were going crazy posting videos, and they were very funny, and I really enjoyed them because they were saying, why pay for Claude? You can use either the McDonald's or the Chipotle chatbot to have them provide you a Python script. And then it will say, okay, and may I help you with your order? Because the chatbots don't know what's the appropriate question, right? It's ingesting your question. And that's become like the new SQL injection problem. It's a problem for the chatbot. Those are one of the hundreds of things that when you're putting AI into your environment, when you're allowing the use of AI, what are those controls that you're putting in place to make sure that it's used as intended? And we don't have these unintended consequences with people using computing and resources, and they're not ordering food. They're asking the chatbot everything other than ordering food from your company.
The interaction with the newer technology, with the older technology, and how they're going to understand each other.
Exactly.
Right.
Exactly.
Helby, what's your take on that?
So we have similar in our academic space. We have some legacy tools, applications, operating systems. On the business side, we're getting a little bit more stringent on the allowable operating systems, the patching and the updating. We're doing a lot of work on the endpoint to making sure that those stay updated. We have a lot of IoT devices, obviously, in our research, in our labs. There is some older technology. We have specialized equipment that the same thing can be updated, and we have to maintain. Then we use network segmentation to make sure that those stay separated, and we segment as much as possible to isolate those. And the idea is to contain if something were to happen, and then also close them out from the internet, right? If they don't need to have internet access, they don't have to be facing the internet, then we also mitigate that way. So we address the risk. We try to understand what is the use, the purpose of the device or the application or the tool, do an assessment, look at it from a risk perspective to understand how we're going to mitigate that risk, and then take action based on that.
And I love what you said, because one of the things that I wanted to mention that I haven't is many times we're skipping over the basics. And I think the basics from a hygiene perspective at times get missed. And when you say the risk perspective, yes, what do your teams do when a new solution comes in-house? No matter how simple or how involved that solution is, Do you have all the necessary documentation? If something happens, do you know what protocols it's communicating with? Do you know what interfaces may be involved? Because if you don't have that information and there's an incident, how can the business react quickly to know what will be affected? So doing a security review is very basic. Identity and access management is very basic. But I think now more than ever in the age of AI, that doing those risk assessments, it's something that if you're not already doing that, it's imperative that process begin.
And sometimes the challenge is, even though you may do a vendor risk assessment before you bring in an application or a tool, every product is now bringing an AI agent. So maybe you did the assessment before it had an AI module or an AI agent, and all of a sudden it pops up because you're licensed for it, right? The department turns it on, and now you have this AI agent that's either collecting information, sending information, and you never reviewed it because when the product came up for procurement, AI wasn't part of the product, right? So then what do? You have to go back and reassess the product. And not so much that you're going to stop using the product, but sometimes you can disable that feature or you do the analysis. And then again, it's this reiterative process to understand what is it that you have to do to continuously protect and continuously monitor these applications. But even through vendor risk management, inserting simple AI questions into your vendor risk management questionnaire to understand what are some of those risks. Who owns that data? Where is that data sitting? Is it going to be only within your tenant if it's a tenant specific type of application, or is it being shared to train the LLMs across their application? So there's specific questions that you can ask and you can put up front that will help you understand what is the risk when it comes to AI in some of these vendors.
Those are the fun Monday mornings. I remember being we use Zoom. And so I'm sitting there and then I see AI note taker. And I'm like, no, because there's a lot of that we don't use a lot of retail type. And so right away, to your point, okay, we turned it off. And it is on for certain leaders. It is on for certain use cases. But especially we don't want that data, that patient data from the AI note taker and the Zoom cloud. So it's always interesting.
And then the conversation comes with your users, right? Because they love it.
Yes.
I have users that love the note taker. Yeah, I like it too. I think it's great. I don't have to sit there and take notes myself. But then you think about what did you talk about in that meeting? How long are you keeping? Data retention when it comes to that. And we're a public institution. Public records request comes into question and into mind. We're using AI tools that are within our institution. So there's a lot of other things that happen. It's not that we don't want you to use it, but there's consequences. There's things that we have to provision and think about first before we can do that. But they all want it back.
PRRR. Oh my God, we do so many of them.
So the risk abound.
Yes.
It's
Yes.
interesting. So we walk around and we're just simply a risk register, humanized, right? We take it all in there, and AI coming in, all these many facets that we could apply it across the business and even for our own operations and security. And whether it is used as applied tool for something else or whether it's used by our own teams to do the things that they need to do, and then how we do it, how we employ it. I think the next thing that I would ask is about what would be the single most important thing that you could say that has moved the needle in your favor, that has given you more return or more value for your efforts, whether it's something in the processes space or something on the technology space. With this whole AI coming in and all the challenges that we already had, plus the ones that are now multiplied and accelerated, and like I was saying, risk abound, you're walking around and your mind is full of risk. Everywhere you look, you see that. But when looking at AI coming into the space, looking for the good things that we've been able to rescue from this, what would be the single most important thing that you could say, I have been able to do this and it's been good using AI. This was an investment or a change in some way that you introduced. What would that be?
Yeah, so I think to me, it's our two key strategic partnerships, our firewall vendor and then our AI solution behavior analytics vendor. Just allows my team is very tiny, by the way. My team is very tiny, and it really allows us to see another day, to battle another day. It really allows our operations to survive, and not only survive, but be offensive, to plan and to strategize and to really, because when you're just fighting fires, you're not able to be predictive So it's really allowed us to go from a reactive mode to a planning mode to a predictive mode. So I think now our mode really is predictive versus reactive. And I have to say that's really key to those key solutions that we put in. I would like to say, and not to go from positive to downer, but
You can stop there if you want.
no, it's just that I've been doing a lot of reading lately. And actually, I've had an opportunity to talk to 2 different FBI agents, and they both confirm that quantum is further along than we really anticipate. Okay. And so when quantum pairs with AI, we can expect that every cipher, usually, let's say most of the internet, perhaps half or more than half, lives off of 2 main ciphers, one being RSA 2048, that once AI partners with quantum,
So
is deprecated. And today, bad guys are stealing government data encrypted. They're stealing encrypted health data. They're stealing all kinds of encrypted data, banking on the fact that quantum is going to be available. So I say that as a public service announcement that we can't just be sitting ducks. The NIST standard put out last year guidance for the federal government to already start pivoting to the new ciphers. There's 3 of them. I don't remember them off the top of my head, but there's 3 ciphers in that NIST guidance. And so again, we can't be sitting ducks, or we have no encryption.
in this challenge, and forgive me before I go to you on this, but so there are bigger challenges, right? You have legacy technology that is able to run certain, say, algorithms and cipher blocks and whatnot. So there are some things that you'll be able to do, but some that would be limiting because of what you have. So our challenges are not easy, no matter which way we slice them, right? So it depends on a series of factors. So for the data at rest, yeah, but definitely proactive, maybe move it somewhere and try to leverage that. That will buy you a little more time and so forth. But yeah, it's a reality.
Email encryption, SSL, VPN tunnels, everything. HTTPS.
So what would be the one thing that you would call out? No? It's hard or now just.
It's harder now.
Yeah.
No, I agree. And leveraging our partners, leveraging the tools that they may have with AI to help us get there quicker, to be able to understand what's happening and detect faster, right? These tools are already with the adversary and they're using them against us. So we need to have the same kind of tools to be able to defend our networks and defend our information. But then also the automation piece, I think, is going to be key, because detecting is one thing, but actually putting into action, doing something, like I mentioned earlier, the automation piece is going to be key. It'll leverage the teams to have more time to do some other things versus just being on a reactive mode all the time. So whatever we can do and look at technologies that can help solve that. And also making sure that we have a clear picture of what's happening, right? If you have point solutions that only look at one part of your network or look at certain applications or at your endpoint, for example, then if you don't have a complete picture, when the threat and the exploit happens, it could be traveling across the network. So you need to be able to detect and connect the dots and see where everything is happening. So I think it's important to be able to leverage the AI technologies for that to help us in that sense. Okay. And then anything we could do to help operationalize our day-to-day, all these tasks that are monotonous, that our teams do day in, day out, because that's part of their job function. But if you can have AI do that and help in that sense, it will free their time up to do
other things.
Yeah.
So yeah, remember, at the end of the day, resources are limited. If we could put them on smarter tasks or activities instead of this other repetitive mundane, that'd be good. So before we hit the end of this, there are 2 questions that I would like to ask you, so we probably gonna hit them up. So I think we stressed enough that our challenges are huge and they're not going away, right? We were already overtaxed with these things, and now it's just bigger in the mix. So in thinking about AI, what would be the one thing that you would want to encourage the industry to accelerate, to create, to provide, right? So that you guys will be able to solve those pain points that you have right now. Just one thing that it will be great if the next month of AI brings in as a fashion of the week. So
I think we're looking at tools to better set policy on AI. And I know that our firewall vendor so we're looking at those with them. And I think those would be important to be able to free our users to use it as intended, but not allow for those unintended consequences, which can be really bad.
Okay. What will you take?
Yeah, I
Your
think
wish.
my wish is that vendors would actually not make it as an add-on, but also include it as part of our tool sets, right? Because you have all these great tools, but you want the AI feature, you got to pay additional, you have to get more licensing. So that really hinders us when it comes to budgeting and procurement, because you want the tools, but you may not be able to get there that quick. Correct.
So closing question now, and this is maybe not so exciting, but important. When thinking about your roadmap, your strategic plans, where are you going, where are you taking your organization? In the context of AI, has this AI raining down on us influenced the way that you are planning your budgets, your roadmaps, your programs from now toward the next what periods? What can you share about that?
Yeah. I think just in a nutshell, I think a lot of people think that AI is replacing, but I think really from an IT security, it is augmenting. It is partnering with, but it's not replacing the human brain and the human expertise. And so I think we're always looking at how we can better utilize those AI technologies and features in those strategic partnerships that have proven themselves. And to me, they've proven themselves every time we have a red team, we shut them down. That's really how we're thinking about it, how to free the human to do more important things. Like you said, we're right aligned with that.
Yeah, and from us, we are higher ed, so it's also educating the use of AI, how do people should use it responsibly and ethically, providing the tools for people to be able to use AI, but also is how are we leveraging it in the academic space, but in research, and allowing our researchers to have the ability to play with these tools in a contained environment where they, like a sandbox environment, where they have the ability to do so without jeopardizing any of the security or any of the information.
I think that's probably going to be a wrap for us. I want to thank you for the conversation and for taking security on a spin that was not so downer among the challenges that we have. So thank you.
Thank you both.
Thank you both. Thank you.